Now, cervical cancer is the leading cause of cancer-related deaths in our country. It's also the second most prevalent cancer among South African women. But now South African researchers are turning up the heat on cancer, and this is quite literally doing that. They're exploring a technique called hypothermia, or heating tumours to enhance sensitivity to radiation. Let's discuss this with Carrie Ann Minnaar from Wits University, who joins us in the studio. Thank you so much, Dr. Minnaar, for joining us today. Now, quite interesting, because just before we went on, you were telling us that you are a doctor in radiation sciences. Now, we know radiation, a key treatment for cancer around the world. Talk to us about this the thermal treatment now that's come into place, this hypothermic oncology.
So thank you, yes, and it's a pleasure to be here. So in hypothermic oncology, what we're doing is heating up the tumours, and the technique that I use is called modulated electrohypothermia. It's a mouthful, but it's very selective, so it focuses just on the tumours without damaging the healthy tissue. And what happens when the tumours are warmed up, they're more susceptible to the damage done by radiation. So, and also it inhibits the repair mechanisms from the damage done by radiation. So that's why we combine the two. So hypothermia is mostly used with radiation, and in some instances it can also sensitize the tumours to chemotherapy, but vast majority of the cases it's a radiosensitizer.
So can one just engage in hypothermic oncology or hypothermic treatment on its own, or does it have to be combined with radiation and chemo?
So the literature is mostly on combined treatment. There are some small studies where it has been used as a standalone treatment, but that's in a very palliative setting.